Telehealth program, you're always right there with your care providers, and you can get help anytime you need it.
It is a video interactive system so that he's on one end of the camera, your mother-in-law's on the other end of the camera, and he can take care of her, examine her, talk to her, interact with her.
Telemedicine is a good, useful tool. We just need to make sure that we do it right.
Southern Remedy is underwritten by a grant from the University of Mississippi Medical Center and by viewers like you. Thank you.
Mississippi has one of the worst doctor shortages in the country. The lack of access to quality health care is considered to be directly related to residents' poor health.
I've lived in Mount Bayou since 1968. My primary care provider is in Ruleville, Mississippi. I worked in the school system for 35 years. I taught comprehensive health and coached high school football and baseball. I was diagnosed with diabetes in 1995. I wasn't able to handle it well because I didn't know much about it at the time when I was first diagnosed, and the seriousness of it didn't seem important to me at the time.
According to the Robert Wood Johnson Foundation, adults in Mississippi have some of the nation's highest rates of diabetes and hypertension. In some of the state's counties, the ratio of primary health care providers to a patient is 6,500 to 1.
We do not have enough providers in Mississippi to deliver health care through traditional means. So telehealth is a necessity for Mississippi.
For almost 50 years, technology has connected healthcare providers to each other and to patients. Can today's technologies through telehealth help cure Mississippi's access ills?
Telehealth is the delivery of health care using technology in its simplest forms. Anything that you can think of doing in person, we can do through telehealth.
Telehealth, also known as telemedicine, is a tool used in doctors' offices, hospitals, and homes. And it's also available in some workplaces through employee health plans.
And so employers or health plans will decide that they are going to offer a telemedicine benefit, just as they would any other health benefit. And so other companies that are very similar to us would be MD Live, Doctor on Demand, and American Well.
We deliver health care to corporations across the state so that employees can stay at work and receive health care at their desk.
Well, telehealth is the best thing since bread and butter at Bank Plus. Our employees absolutely love it.
Hey there.
Hello, how are you today?
I'm good. How are you?
Not the very best, but we'll make it. You're at work. I mean, you have things to do. To go sit in a weight room with other sick people, I mean, it doesn't help your solution. To be able to go in, get treatment in 15 minutes tops. It keeps you in an environment where you can wipe down and keep your area secluded from any other germs and things like that. Dry and, just have a stop.
First thing they do is they call telehealth and set up an appointment.
All right.
But they then get online with the doctor. Usually once they log in, it takes less than 15 minutes for the doctor's visit. It is a very similar experience to an on-site clinic. The difference being, of course, you're in person at an on-site clinic. It's just like going in your doctor's office.
My first visit was actually great. The nurse practitioner, she was there. She was involved. She was concerned. They really wanted you to get better, and they wanted to be a convenient way of getting back to work and not taking the time away from you. And they understand also that you are very busy.
Business leaders say that employees connecting on-site to a healthcare provider through the internet helps keep costs down and is convenient.
Imagine if a board-certified doctor was available anytime, anywhere, whether you're at home, at the office, or on
If this benefit isn't available at work, access to care for basic ailments or mental health counseling is just a click or tap away. All that is needed is a credit card and internet access.
The ease of being able to access a provider for a minor problem for which previously the only access you had, because say it was 6 o'clock, 7 o'clock at night, was a hospital emergency room. And looking on one hand of being able to have access to that physician for $50 versus going into a hospital ER for the same problem and it costing me $1,300 to $1,500 becomes an obvious solution to the issue.
University of Mississippi Medical Center currently does not have direct consumer capability in the way that you would normally think of it, and we've done that for a very specific reason. We are not in the business of trying to compete with our local primary care physicians, so we have chosen not to go direct consumer at this point. All of our what some people would consider direct consumer go through corporations.
I cannot emphasize enough, telemedicine is not to replace, it is a small niche to provide a service that's not normally being met, but it is not the end-all to catch-all.
I understand that we've got access problems in this state. We've got people that cannot come to the physician and cannot make that expensive road trip to the tertiary center 60 to 90 miles away. And so in that respect, but there is something to be said for having an understanding with the patient, knowing what that patient is capable of understanding, and having some sense of what can be conveyed over a telemedicine encounter.
I'm not saying that UMC won't get into direct consumer at some point. If we do, we will likely try to figure out how to do that with local hospitals or local community physicians, so that we can make a holistic community of healthcare instead of fragmented.
Direct to consumer has its spot in healthcare. What that tends to be designed for to me is the person that's relatively healthy, that may have an acute episode, that's self-limiting, that might need a provider's input, maybe a prescription, but once that's resolved, they're able to continue really pursuing their health without chronic needs.
One of the issues that can happen, not saying it happens everywhere, with direct consumer is you have a certain group of physicians, whether they're private, out of state, wherever they're from, that are taking care of a specific illness with a patient, and that information doesn't always get back to the people that are required to take care of them on a day-to-day basis.
What I don't think that model fits well with is patients that have a huge healthcare burden. That episodic nature of that tends to just fragment care and leads to, in some ways, a dilution of the care plan that we're trying to create.
Another option for access to a doctor or a nurse is through a telehealth kiosk at a pharmacy. National telehealth companies have set up kiosks in major pharmacy chains in several states, creating a walk-in clinic. This retail pharmacy access in Mississippi is led by a local telehealth company. I talked to Chris Powell from Telehealth One.
The service right now is being implemented in retail pharmacies where patients normally get goods and services related to a pharmacy and household goods. Patients have the ability to come in with a primary complaint. They can connect using telehealth models to see an advanced practice provider or medical provider. We have an agreement and a relationship with Fred's pharmacies and retail stores. We know geographically that there is a store that has a pharmacy within 15 miles of every patient in the state of Mississippi throughout the 82 counties in the state. This is our simulation room right here.
All right. And so you would be the pharmacy tech that helps me get hooked up here?
Correct. So you just entered the threshold of the retail pharmacy and you've identified some patient complaint, sore throat. And
I have a cough.
Exactly, so you have a cough. Okay. So I will be the healthcare technician that begins registering you. And then I will introduce you through the kiosk after I get your information so you can talk to the provider.
Okay.
Hey, how are you, sir?
Listen, I've got for the last couple of days, you can sort of tell from my voice, I'm very hoarse and I've got a sort of an irritated cough. And I was wondering exactly, what I ought to do. Is there something I can take over the counter? Do I need a prescription? Do I need to go to my primary care doctor, which is very inconvenient because it's a long wait to get in to see him? What can you tell me?
Well, let me ask you just a few questions, and then maybe we can decide exactly what would be best for you, sir. Are you diabetic?
No. I'm in good health. I really don't have any problems other than elevated cholesterol. and a bad temper that my wife is adjusting.
Oh my gosh. I'm working at that.
But we can literally look in the patient's ears, their posterior or the back of their throat. And we also have stethoscopes that can send sounds over the internet as well too through this model. So we can do a full service other than touching an evaluation of the patient.
Can we take out the oral camera and go ahead and take a look at your stroke real quick?
Sure. Okay, Dr. Rick, if you just open your mouth really good for me.
You hadn't adjusted yet. I think those look a little red, like you've been having that post-nasal drip. I didn't see any swelling or any little pustules there on your pillows or anything like that. That looks good. So it looks like you're probably having some post-nasal drip going down the back of your throat.
I'm having a little trouble with my ear popping over here too. Is that related to this other thing? It all seemed to come at once.
So when you cough and you've got excess mucus, it plugs that little tube that goes between your throat and your middle ear. Hey, Chris, can we take a look inside that ear? You'll have to focus a little bit.
I'm getting there.
Getting better. I don't think it's infection. I think we just probably got some middle ear pressure. And you've not been running any fever, have you, sir?
No. This sort of plugged up.
All right, well, we need to unplug it if at all possible. I suggest a couple of things.
What's the scope of practice for your providers?
So it is limited. These are primary care type, urgent clinic visits that we would manage. There are some things that we simply just can't manage, either due to imaging, the limited availability of equipment, and those travel down another path.
The Mississippi Diabetes Telehealth Network is a program that was started a little over 2 years ago as a way to see if monitoring in patients' homes would be successful in managing chronic diseases. We have our remote patient monitoring staff. These are nurses who are watching our patients, our chronic disease patients, in their homes.
Telehealth program, you're always right there with your care providers, and you can get help anytime you need it. Well, there's a signal that goes off in the morning that it's time for your check, your routine check daily, and then you set your machines up, and it takes you step by step. That's what to do to check your blood glucose.
All right, Ms. Clark, how are you doing today?
Good.
Tim Alford is a family medicine doctor in Attala County. He's using technology to strengthen patient care in his family medicine practice.
I am doing this new model of care called direct care medicine. I can spend more time visiting with the patient, doing problem solving. In fact, my visits are 3 times longer than they used to be. So any way that I can have an extended eyes and ears to that patient, I want to do that. And so I use it on a continuum basis, but I have established a relationship with all these people. I call it a benefit of the practice.
This use of telehealth keeps patients connected to their regular primary care doctor when they can't get to the clinic.
Good morning, Linda.
Good morning.
So you came in, you had a rash across the right side of your face, and if you'll remember, we wanted to make sure that the rash was just limited to your face and was not involved in your eye.
But now it's starting to get kind of painful.
Linda, what I need for you to do, if you would, is kind of turn your camera towards your face just a little bit. Yeah, it looks like the rash is kind of resolving. What you need to do now, you've got to finish out that medicine. I think it looks like from primary care, where we're taking care of 90% of medical problems that come to the physician, it's a little bit more unwieldy to think or to handle all these problems over a telemedicine phone call. Sometimes a problem needs to be deferred back to the clinic.
And sometimes seconds matter the most.
When did you last feel normal?
When a stroke strikes.
Most people in rural communities, most rural hospitals, do not have an on-call neurologist or someone in that ER 24 hours a day.
With more than 42% of Mississippi adults with high blood pressure, the conditions for stroke are favorable. Some medical experts say access to specialists through telehealth can prevent stroke, death, and disability.
All that's required to make the assessment and to give the go-ahead to give the therapy is a review of the MRI or CAT scan to determine if it's a thrombotic stroke.
Technology helps smaller hospitals and rural clinics access medical specialists virtually. A doctor with a Mississippi medical license can be physically anywhere to provide virtual consultation with those attending the patient's bedside.
Not only is there a problem with patients seeing a primary care physician, but there's a problem with the primary care physician being able to access consultation that they need. They may need expert input about a certain patient.
The primary care physician may have a patient who needs to see a cardiologist in a remote site in Macomb, let's say. Well, they can connect to our center and we can make sure that that happens so that as the physician seeing it, it's just like a regular clinic appointment for them, but it could be that they're in Macomb or Tupelo or Grenada or wherever.
It is a huge benefit when patients are able to get expert services where they are because they're in their provider's office. They trust them, they know their staff, they're very comfortable there, they're very open.
I'm the only geriatrician in North Mississippi that practices in that capacity. Over the past several years, I've had to give up my nursing home practice because of the time that it took me to travel to each of these long-term care facilities. But with telehealth, just this morning I saw patients in Iuka, Pontotoc, and I didn't have to travel anywhere but just to my office here.
My mother-in-law, Melba Pugh, has been a resident of the Pontotoc North Mississippi Medical Center Nursing Home for about a year. She has dementia and she takes a lot of medication. And my husband became concerned that perhaps she wasn't on the best medication or didn't need to be on all the medication she was on, and so he asked if she could see a gerontologist. So when he spoke with my mother-in-law's primary care physician, Dr. Stephen Dermeyer, he said, absolutely, and we can do one better. We can have Dr. Greer see your mother-in-law, and she doesn't have to leave the comfort of a nursing home.
Hey, how are y'all?
I'm doing fine.
How have you been feeling?
He said, how have you been feeling? I've been feeling pretty good.
We were going to check in on you and see how you were doing today, okay? Let's take a listen. I want to listen to your heart and lungs.
It makes it easier for them, and we have the options now of the different specialties of whether it's gerontology or the wound care or whether it's nephrology, pulmonology, our behavioral health. So whichever specialty that wants to link in with us, we can utilize that specialty with those physicians.
Being able to have him there through the video interactivity, that's improved her quality of life.
Okay. Tell him bye-bye. Bye.
Bye.
At this statewide telehealth conference, in-home monitoring was touted as a key solution in disease management.
As soon as we started to see these patients in their home, everything changed from a medical perspective. We found out that it was not simply that we could see them in their home, we had to see them in their home.
The University of Mississippi Medical Center conducted a study that uses telehealth to closely monitor patients in the Mississippi Delta. Leroy Henderson from Mound Bayou is one of 200 participating in the study. He lives 133 miles from the medical center in Jackson.
The telehealth technology has helped me tremendously. It has given me information on how to live well with diabetes and the complications of diseases and disorders associated with diabetes.
Good morning, Coach Henderson.
Good morning, Melissa. How are you?
I'm good. How are you doing?
Doing just fine.
Good to see you.
Oh, yeah. Nice to see you today.
I was just calling to check on you. I had gotten your glucose reading, and it was a little bit high, so I was a little worried about you.
We were able to teach these patients about their healthcare needs, and more importantly, teach these patients how to manage their own health. But it's through real-time feedback, so that as they were doing things that caused their blood sugar to go up or caused an adverse outcome, we were able to intervene immediately. You pick up the phone, we call the patient and say, hey, listen, your blood sugar is twice as high as it was yesterday. What happened?
Well, everything's going fine. I think it was what I had to eat last night.
Okay, so tell me a little bit about what you ate.
Well, my evening meal was fine, the string beans, carrots, and smoked turkey. But my late night snack it was too much. I had too many graham crackers.
Okay.
It wasn't that difficult to get used to the technology once you go through it a few times.
Pretty comfortable looking at the servings?
I'm pretty much comfortable with it. Sometimes, I kind of veer off, and I can tell the next day, yes.
Okay, so you can tell a difference. Do you feel different when your blood glucose is high?
A little bit. Video conference is very helpful. It seems if you're sitting right in the office with your care provider.
Okay, good.
I would tell anyone that has a problem with diabetes that to try to get involved with the telehealth network, and it's awfully helpful, and it keeps you up on your diabetes. It reminds you, like, every day what you need to do to keep going and to keep your blood glucose level that you can live with.
In the first 100 patients, first 6 months, there were 0 ER visits, 0 hospital admissions for diabetes out of these 100 patients. That is unheard of.
There is a lot of developments on the health policy side for telehealth and telemedicine. It's a disruptive innovator. It really is changing the way we deliver care.
Telehealth services in Mississippi are regulated by the state health department. The legislature makes laws on how telehealth services are delivered and how insurance companies pay benefits.
In Mississippi, telemedicine has to be both audio and video. So when the legislature set up the reimbursement rules and changed the codes in Mississippi to allow for telemedicine, they set it up as a live audio-video interaction.
A measure that failed in the 2016 session would have expanded telehealth services to other electronic media. The Mississippi Medical Association disagreed, issuing a statement that this bill would allow out-of-state physicians to diagnose and treat Mississippi patients exclusively via phone, and went on to say this would not ensure continuity of care.
Policy part of it is not real complicated, and so you look for 3 things. You say that a patient-physician relationship can be established using telemedicine. You say the standard of care for telemedicine must be the same as it is for traditional medicine. And lastly, you say that it should be technology neutral.
We're here today because the House has passed a bad bill. And we're asking
the House bill actually was being a little bit too lenient with what the requirements for what we felt like comprise good telemedicine.
What we want to ensure is that the use of telehealth helps with coordinating care and reaching patients to reduce fragmentation.
One telemedicine that uses technology to replicate the in-person encounter so a patient can get care without driving to a bigger city. That's two-way, real-time, face-to-face, audio, visual.
If we can't repeat what's happening in person through telehealth, we don't believe it should be provided through telehealth. This year, a group lobbied to change that definition to provide for phone-only services as well.
Good telemedicine policy would say that it is technology neutral. And I will speak for Teledoc. We offer audio-video. We offer interactive audio using asynchronous store and forward technology. We do not offer, nor do we support, phone-only telemedicine visits.
A picture, it's been said, is worth 1,000 words. Medicine, or I guess telemedicine, without the visual component is bad medicine.
And technology neutral is extremely important because we know what is available in 2016. We don't know what 5 years down the road will look like.
Really what we're talking about here, we're talking about trying to get it right and then keep the quality component, keep the standard held high so that this can be a useful instrument.
House Bill 1178 is bad medicine. It lets out-of-state companies off the hook for providing standard of care that we think is correct.
Some medical boards are pushing away from telemedicine companies that predominantly use just the telephone. There is a bit of an irony there, though, because previously, when a patient called me in the middle of the night and I said, somewhat jokingly, take 2 aspirin and I'll see you in the morning, there was nothing wrong with that. And if I were covering for one of my colleagues and I had never seen that patient before, I did it over the telephone. So there's a bit of confusion, I think, in the minds of folks on many medical boards today.
We are so far behind every other service industry that exists that it is really criminal.
I think people will begin to see healthcare and its service delivery system catching up with every other service delivery system, like commerce, like banking, like entertainment.
Right now, it's simply cameras, but it will be commonplace, and it will just be the accepted way to connect to healthcare.